alaikum and hello everyone. I'm your host, Hena Zuberi, and welcome back to another episode of Justice for All Now. You're watching us on Muslim Network TV, on Galaxy 19, Roku TV, Apple Fire TV, and you can watch us on YouTube as well and several other social media channels. Today I wanted to really talk about healthcare as a human right, especially in the United States. US life expectancy is lower than most from the Organization for Economic Cooperation and Development countries. Japan has the highest, 84 years. In the United States, it's about 79 years. More than 26,000 Americans die each year because of lack of health insurance. Health spending per person in the United States was between $10,000 almost $11,000 in 2019, which was 42% higher than Switzerland, the country with the next highest percent per capita health spending. This is extremely concerning, especially for us living here, American Muslims, and we often talk, many of us in our communities are doctors or nurses or other healthcare providers, and we contribute a lot to this country's healthcare system. Let's talk a little bit about the average spending amount on healthcare per capita and compare in comparable countries. 56,000, which is roughly 5,600, which is roughly half of that. In the United States, it's almost $11,000. Amongst the public overall, 63% of US adults say that the government has the responsibility to provide healthcare coverage for all. Many of us are filing bankruptcies because of medical issues as a key contributor to our financial downfall. 62% of bankruptcies in the United States were medical bankruptcies. A 2015 study by Kaiser Family Foundation found that medical bills caused 1 million US adults to declare bankruptcy every year, and that 26% of Americans age 18 to 64 struggle to pay medical bills. Why are we talking about this? Well, in today's episode, we wanted to highlight the work of two exceptional people. We're going to be talking about COVID-19. Our 2020 was in a year that we, just ended. A lot of people have been reflecting about what transpired in this year. And what we are seeing is that until something is memorialized, until we really put it together to see I remember this when do you guys remember when those shoes were laid out in front of the halls, in front of the fields, in front of the Congress, which is, by the way, right now being attacked by Trump supporters. I hear some sort of gas has been released, windows have been broken, astronomical, event in the history of the United States. I don't think the U.S. Congress Capitol building has ever been stormed by Americans, which is currently just happening in Washington, D.C. But I remember the moment where all the shoes of these young people who had been killed by gun violence had been laid out, and it showed the country the immense amount of people, immense amount of children, how many children we have lost to gun violence. So something similar that there's two beautiful people that we know, Ruth, Mohammed Nasrullah, who is a longtime activist and community organizer, and Ruth, his wife, Ruth Nasrullah, a dear colleague of mine, who's a freelance journalist based in Houston, have put together a virtual wall of memories for COVID-19 victims. Let's take a look. Thank you, Mohammed and Ruth, for being on here today. Let me let my audience know a little bit more about you. Mohammed Nasrullah is a former project manager who's worked on NASA projects for almost 40 years. He's a former board chairman and president of CARE Houston, and he served as the president of the Amnesty International Bay Area Houston chapter. And he also serves as the executive board of the Multicultural Center in Webster, Texas. And Ruth is a freelance journalist based in Houston. She's written for a range of publications, including the Houston Chronicle, American Muslim Today, Aziza Magazine, and Muslim. She's a colleague of our founder of Muslim Matters, one of the co-founders of Muslim Matters, left a legacy, mashallah. And she's also the president of the Houston chapter of the Society of Professional Journalists. Welcome both of you to the show. So tell me, what gave you the idea to start this beautiful project?
So, Bismillahirrahmanirrahim. So when back in February and March of last year, when we were watching the news of this pandemic, the effect of the pandemic, the number of cases, number of hospitalizations, number of deaths from this virus, and we would look at these numbers, and we would go, there's people behind these numbers. These are folks in our own community, our neighbors, our doctors, our nurses, our teachers, and we felt like we need to put faces on these numbers. So when it came to, like, in April, when the number of deaths were like 100,000, we felt like we needed to take action, and that's when we sat down. We had this vision of a memorial, a virtual memorial similar to the Vietnam Memorial, that would be on a website which would display the victims' pictures, and then when you click on a picture, it will give you a detail of who they were, what they did in their life. So, and then when we discussed it with Ruth, of course, she brought in her journalistic experience and added more data on this vision, and that's how this whole thing came together. And we've been working with a web development company and over the last several months, and now you see a completed project where right now we have a little over 600 COVID victims in the US that are on this virtual wall.
Wow. It's fascinating. Thank you so much for the work you've done. Ruth, tell us more about how you collected these images, names, photographs.
Sure. Yes, they right now they're all from online obituaries that were taken from all over the country, and our goal is to have people enter information onto the wall of their own loved one who passed away from COVID, because we're trying to tell really authentic, genuine stories. So that's our hope, is that we'll increase the number of people who are choosing to honor their loved one on the wall. So, but what we see now is just, it's amazing to see it, to see the screens go by, because we started with just a handful and now there's over 600, and you just sit and watch it and it's just so moving. I had last week, I was doing a bunch of data entry and watching it scroll by, and I was like, they're all smiling, which is really sad. And then I said, maybe they're smiling at me because I put them on the wall. It kind of takes you into that headspace, but it's
How
really.
has the last year been for both of you? Let's start talking about what has post-COVID been like for both of you.
Well, I have the privilege of being able to stay home. I'm not a frontline worker, so I'm very conservative about social distancing, and I spend most of my time at home working, and just very nervous about it. So for everyone as well as myself.
See, in my case, I like to be outside. I like to be working with people, meeting in physical, in-person meetings and all that. So that was a big change in how I operate. But I've been, the silver lining of the pandemic has been that now that I don't have to drive to meetings or to activities, I'm using all the extra time to do things that were on the back burner for many, many years. I've been able to reconnect with old friends and old family members that I had not talked to or connected with in many, many years. And these virtual get-togethers have been really, really helped in reconnecting with family and friends. That to me, that has been a big plus in this pandemic impacts on my life.
Definitely. So, Ruth, as you guys were working on this project and gathering data, what are some of the things that a lot of times that's not emphasized in, especially in mainstream media. If you could share some of those findings that you found while putting this project together.
Sure. We came across a couple of interesting phenomena. We had 2 or 3 couples who died within a few days of each other, and then their kids wrote the obituaries, and it's mind-boggling, to imagine that. And I do know someone from where I grew up in Jersey who had a friend whose both her parents died, and unfortunately, that also means that they died alone because. So there was some cases like that, and some young people. And it's interesting. In the beginning, it was mostly older people, and I guess as time has gone on, we've just had more and more, middle-aged and kind of going down from there victims. And I guess Mohammed also came across. There was one, I guess, in particular that he was very taken with, a 23-year-old, I think.
Yeah. It was a 23-year-old young man from, I think, either New Jersey or New York, and he had just started his own company of advertising and marketing. He was the CEO of the company,
Mm.
and very healthy person. Before he contacted COVID-19, he was healthy. He had no issues, and in less than 4 weeks, between the time he contacted the virus and his passing, just less than 4 weeks, he passed away. Some of these, when I'm uploading the obituaries to the database, it is some of the stories are so sad. It's you have to stop what you're doing and just leave your laptop and go do something else to get away, because there's so many sad stories and among these people who have passed away.
Seriously. Yes, and this is something that, as you mentioned, that in the beginning when we were told about this disease, it was widespread that this affects older people more and people with other diseases that could impact them in a much more harsher way. But as the news has come in, we've seen younger people being affected by the disease, and perhaps this is because it's changing, it's mutating. Which state was hardest hit?
Definitely New York. I mean, we all saw the scenes out of there from back in the spring, and they had a break. They had that strict lockdown, so they had a break. But now that we're in, whether it's the third or the second surge, I don't know, but things are a little bit better there. But they still, I believe, continue to have the highest number of deaths.
Mm.
And then I think it's California, and then Texas. Mohammed,
No, it's Texas is number two.
okay, and then yeah. So, but New York really suffered. I think I read a statistic that 1 in 200 people living in New York knew somebody who had passed away from it. So,
Definitely. Just personally, my husband is a physician in New York. He's doing his hospital was one of the hot spots, and yes, it is terrifying. And there were times where, and the hardest hit were these Black and brown communities.
exactly.
The Bangladeshi community lost more than 500 people within a span. So this is this something that you have noticed too as you're gathering the disparities between, and I'd really like to talk about that because this brings us back to that whole healthcare as a human rights issue. So what were your findings as you have been putting this together?
Well, since we've been taking our information, our stories from online obituaries, the picture that we see when we look at the wall is not really reflective of how things really are. You can see there's a lot of white faces, and that doesn't reflect the much greater number of people of color who have been affected by this disease. And that's something that we're reaching out to the community, and it's a primary goal of ours to make sure that we do have that representation and that those stories are uplifted, because that's so important. What we're trying to do is amplify the lives and share the voices and the stories of these people. And so if we don't include all the victims, then we're really not achieving our mission.
That is so, and Brother Mohammed, if you'd like to comment on that.
Yeah, okay. So, like Ruth said, what we have in on the wall does not really represent what is really happening as far as communities of color goes. So we have had meetings with some community leaders so far. In fact, when we had the open house, Dr. Muzammil Siddiqui joined us, and he took an action to help us spread the word about this website and this project in the Muslim community, because we have, out of the 600 plus people honored on the wall, I believe there's only one or two that are there, and we really would like the Muslim community to come to the website. And it's an extremely simple process to upload their loved ones' information on our website, so we can honor them as we have honored other folks. So this is the right place for visitors to click on the button which says share my loved one story, and you go through a couple steps and it opens up into a simple form that you fill out, upload a picture, and their job is done, and then we take over from there. So this is what I would like uh, visitors and viewers to, if you know a loved one, or if you know someone who has lost a loved one to this terrible disease, we would love to honor their life. Just go to our website and upload their information.
So, folks, it's COVID-19, www.covid19wallofmemories.org. So if you have lost a loved one or a friend or a colleague and you would like to honor their memory, and please submit your story. We would like to see this wall really reflect what has happened in minority communities as well. And thank you so much for bringing that up, that right currently, and that speaks of privilege, right? And also it's also cultural as well. We don't really submit obituaries, and this is that's probably one of the reasons why the wall is not reflective currently. I did want to, I saw this really great aspect that you have shared on the COVID-19 Observer. Can you share what this is about, Ruth?
That is my pet project. It's as he said, I insisted, well, we had to have news because I wanted to have news, but also because you find a lot of compilations, like newspapers do faces of COVID or those we've lost. And I said, this has to be something broader and different. And so this is my pet project. And the articles that are up there now, I think, really reflect the range of topics that I want to cover, from medical to, there's a couple of first person stories, including one from one of our Houston City Council members who had COVID. And then cultural things like the impact of COVID on the jazz scene, which is what my dad wrote. And so a variety of things. And I have a small team of writers right now, but we're developing stories coming up. And one thing that's becoming clear is just like the disparities, just in terms of the data, in terms of who's getting sick and who's dying. There's a story of different marginalized minority communities and I'm seeing now that we're going to do a series of stories about them. So, I'm really excited. The idea is, we show the stories, we show the faces, and that kind of, it touches you here. And then we have the news and information side that kind of touches you here a little bit more. And that's our goal, is to inform and move people.
This is beautiful. I would love to see all these social media posts collected in one place of doctors and nurses who shared their struggle, especially in the earlier. This was something that really changed that narrative about who is the hero. And for the first time in that I've been, in my life, that I've seen soldiers not be that meme, that hero meme was replaced by doctors and nurses. So it would be great to see that. I also, I'd love to share some of the articles that I know we published at Muslim Matters and some of the shows that Muslim Network TV has done on this, just to see how people celebrated Eid. There was, and we were giving advice to our Christian friends. Oh, we did this. We did 2 Eids without being able to see our loved ones. So I'm sure this is wonderful that it's really holistic, and it gives a much broader picture than just that's because it's changed society, it's changed the way we do marriages, weddings. And what I would like to ask you, what part of this would you hold on to, like this post-COVID? There are lots of lessons that were learned. And I really do hope, honestly, for my own self, that I don't go back to pre-COVID years. There's some things that I just do not want to come back into society again. So I'd like to hear your thoughts on that.
Well, I know what I would say is during Ramadan, I think, we had I wrote an essay actually for Religion News Service about how we have our own little masjid, just me and him, and that we, pray Taraweeh together, alone together, and Eid and all of that. But I think that, Mohammed, maybe you could share that you had some kind of changes in terms of your outlook, your religious outlook, and your, practice and all that. So I'm going to put you on the spot and ask you to share that.
Well, just during Ramadan, since I was not going to the masjid for Taraweeh or breaking fast or anything, I spent I had some extra time that I spent not just reading the Quran, but reading the translation, and I had time to reflect on what I was reading. So I felt like I got a lot more than just going for Taraweeh. So that's one thing that I really liked about how things have impacted because of the pandemic.
Yeah, definitely more time to reflect. I just don't miss the commute. I don't miss driving the kids to school and back, or even like my youngest is in a madrasa, and I don't even that was you left the house this way. That I definitely don't miss that. And just the materialism, I felt like in many ways it made us realize what our spending habits were, where we're spending our money, what we're, like the gigantic weddings that we have in our communities, that we can do it on a smaller scale and can be just as beautiful, and really like putting our friends and people who mean the most to us, bringing them back, putting them in focus in our lives. That's something definitely I do not miss. And I think of even the impetus of starting this TV channel. I don't, if we had waited to create those studios, but when we saw even CNN is doing reporting from their dining tables, hey, let's go, we can do this. So so sometimes you're always waiting for the perfect, and the perfect doesn't come. So you just need to start. How has the local Houston community been affected by COVID? Like aside from the mosques and do you think what changes have you seen in your own local communities?
Well, okay, so I am, my other job is I'm very involved in on the political scene. I was in 2020 was really busy with the election that was coming up in November. And normally, pre-pandemic, there would be so many different activities that I was involved in, as voter registration, getting the vote out, and all that, and doing block walking, and we could not do any of that the way that we had done in the past.
Mhm.
When we did things like block walking, we would actually go knock on a door and talk to somebody there to hand them literature or convince them to go out and vote. Well, we could not do that, so we came up with this thing called a no knock block walking, where you would not knock, but we would tape the literature that we had you know put together for that particular house. And when we were doing voter registration in the past, we would be doing voter registration where people will fill out a form, and we, as voter deputy voter registrars, we will sign and do all this interchange of activity. Well, with the pandemic, all we were able to do was just hand out a form from a distance with mask on, and just ask them to take it home and fill it out and mail it, and hoping that they will do that. So there
Mhm.
are so many things that really impacted how we did things.
Yeah. And I had a lot of frustration because I'm always the first one out the door when there's a protest or when something's wrong. I'm always out there. And, for example, George Floyd, of course, was buried here. So they had that huge rally the day that, I guess the day that his body arrived here. It was like 60,000 people. And I really wanted to go, but I really didn't want to be among 60,000 people. And even though everyone said, we'll be wearing masks, it just didn't seem safe enough to me. So, but that's been a source of tremendous frustration, is not being able to go out with my signs. We have like a closet full of protest signs. So,
Bond over that.
unfortunately, we know which issues haven't been resolved because we still have those signs ready to go. So, yeah, so that's and volunteering and all that. It's just, yeah.
Yes, it is. And one thing I did want to talk about, I spoke a little bit about this in when I did the introduction, was that if we study bankruptcies in this country, and I really want to connect this like whole wall of memorial, like these people who passed away, many of them are going to leave behind medical bills. Like, it was to be in the hospital for that long, sometimes on breathing machines, sometimes without, not being able to, and die alone. So many of them dying, many without family members around, no one to read Quran over you. These are something like that. It amplifies the tragedy that we all, the tragedy of already losing a loved one. But after they're gone, the debt on the living that is left behind. So, a study of all bankruptcies in 2007, researchers classified a medical bankruptcy as one where a person had to mortgage a home to pay medical bills, had medical bills greater than $1,000, or lost 2 weeks of worth due to illness. And now, putting this in the context of COVID, where people are losing jobs, can't afford to pay their mortgages. And at that time, it was 62% of all bankruptcies in the U.S. Were called, and most of these people had our current health insurances, right? That and so how do we? This is like our healthcare system right now, and just post COVID, a for-profit healthcare system. I'd really like to get both of your comments on this. You're involved in politics, you're involved in grassroots organizing, your communities. Just your thoughts on this.
I mean, first of all, how can it be a problem when you're getting a check for $600, right?
Mhm.
I mean, that's so much of this whole COVID disaster has been and continues to be neglect by the federal government, neglect on the part of some state lawmakers, and to some extent, it didn't have to be this way. And so the bankruptcy and all the financial suffering is in large part because of that. And I hope that things are going to change and starting in a couple of weeks. So, yeah, but you're right. I mean, when you see fathers of families passing away, and you have to think, well, what is the family going to do?
Mhm.
And the when I see the impact on the minority communities or communities of color, communities that are economically depressed. There's so one of the reasons is they don't have access to affordable health care, and when you have to make a decision between the limited resources that they have, whether they use to pay their rent or buy food or buy medication. And when you have situations like that where they have to make decisions like that, you end up you know taking care of the rent or the food, because now you don't want to get evicted or you don't want to starve, and you may end up not taking that medication that are required, especially when you have things like diabetes or heart conditions or so. Then you certainly are a high risk to get this virus.
Mm.
And that's one of the reasons why you see such an disproportionate number of victims in those communities.
Yeah.
When I reflect on the number of dead, it's just unbelievable to think 350,394 Americans dead in the United States from COVID-19. Just what do you feel when you see that number?
I mean, it's literally hard to fathom. I read an article the other day, I think in the Washington Post, about the psychology of things like this, that people in general can understand the concept of 10 people in a room or 20 people getting sick. But when you get up to, let's say, 100,000, okay, maybe you have a sense, but when you get up to the numbers where they are now, it's hard to picture them as people. It's just, mentally difficult to understand that. And that's one of the things that I hope the website breaks down for people, because you see each individual and you hear their stories, and hopefully that will help to sort of help people to understand it, despite the vast numbers. And we have said, initially when it was 100,000 when we started, we said, all right, we'll have the goal of trying to go for all 100,000. Well, of course, now it's 3.5 times that.
Mhm.
So the question is that an achievable goal? If, God forbid, it goes to like 500,000 or something, is that an achievable goal? Maybe, maybe not. But every single person deserves to be counted and deserves to be on the wall. So our goal remains all of them. If we can, we'll get all of them on the wall, but, and share their stories. But yeah, it's just really inconceivable.
It's when I think about it, like, and it could have been stopped.
Right.
I personally think that President Trump should be tried over this.
Mhm.
What are there any movements towards this? I mean, he should be tried for a lot of crime,
Right.
but the this
You
and
know, I
yeah, death is in God's hand. Perhaps these people would have died of some other calamity, but this was intentional. This was intentional, especially when you saw when uh, just everything that has happened on that national stage in the past uh, 9 months.
Mhm. Yeah.
Mohammed.
yeah, then I have talked to several folks about whether there's so many cases where relatives have come out and said that my uncle who died or my grandfather who died, he listened to the president
Mhm.
and did not wear a mask or
Mm.
did not social distance, and he got the virus and he died. So there's literally thousands upon thousands of cases like that. And I've talked to several folks with the idea that can these people, relatives of those victims, have a action suit against President Trump or his administration, because this is this. I mean, it's just not acceptable for a country like ours to have such a really such a high rate of number of cases and number of hospitalizations and number of deaths. It's just not acceptable. It really should not happen that way. I
And
mean, this is a pandemic. I mean, we would have seen some impact, but nothing like this.
like nothing like this,
Yeah.
especially in a country already which does not have health care for all. We believe that the right to health for as a I represent Justice for All, human rights organization. We believe the right to health for all people means that everyone should have access to health services when they need it, where they need it, without suffering financial hardship.
Right.
And then no one should get sick or die because they are poor or because they cannot access health services that they need, especially not in the richest country in the world.
Right.
Yep.
So this is, yes, go ahead, Ruth.
I was just going to say health is not a commodity. It's a right, and that should be reflected. I mean, I wonder sometimes also, they talk about some people being found passed away at home. And I'm wondering if some people just did what a lot of uninsured people do, which is put it off. I'm not going to go because I can't afford it. So, I mean, it's just a tragedy. It is. It's a human right. You're absolutely correct.
And you said that, like really that point that health is not a commodity. It's just, but we have commodified, like even just the way it's changed in the past 20, 30 years, how healthcare in this country, like you go in and you feel like a machine, like someone just comes in, you've got those 10, 15 minutes, you can't go beyond that. Gone are the days where doctors would sit with you and try to holistically figure out what was wrong, unless you find a specialist or somebody who really practices holistically like that. And you feel like, okay, it's a machine. You come in and boom, 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 you've got your test and, move on to the next thing. So even that whole, the way healthcare is, and so yes, I definitely echo those feelings. Brother Mohammed, as you work in the, as especially in your politics, what are some of the initiatives that you've seen in your community, especially towards getting better healthcare or healthcare for all? What are some of the initiatives that you have seen?
Well, the most common option that most folk that I know prefer is an improvement on the Affordable Care Act. Because the initial one, and then this is extremely similar to the history. If you go look at the history of how Medicare developed, the first version of Medicare was not as good as what we have today. So, the most common version that most folks want is an improvement on the current Obamacare, and just try to expand it to everybody that does not have access to affordable health care, with still an option that's available. If you're working for a company that offers healthcare, then you can opt out and go with your employer's offered healthcare programs. This is extremely similar to what. So my brother is a physician in Sydney, Australia, and they have something similar. Everybody, including citizens or non-citizens or even refugees, are covered under that plan. So nobody goes or has any issue with healthcare or access to healthcare. So that's the uh, hopefully with the two wins, hopefully in Georgia, President Biden can improve on the Obamacare in the first, at least the first couple of years of his presidency.
So one of the things that I did notice, especially and which concerned me on privacy rights, human rights across the globe, and not just in the United States, is to mitigate in countries that did work really hard to mitigate the spread of COVID-19 throughout the world. They introduced emergency measures, right, that constrained many of our individual freedoms, social and economic rights. Um, so this is something that was concerning. What did you notice here in the United States that you thought some of these measures, obviously, like closing schools and workplaces, were just, you know, needed and mandated, canceled public gatherings. But what did you see any? It could be here in the United States and other places where these some of these measures went overboard and almost like especially concerning. I'm really concerned about electronic surveillance, things like that. In places I know in UAE, they put an app on your phone. Every time you leave the house, you have to check in on that app.
Yeah, I had some concern about those, contact tracing apps. When I first heard about it, I said, yeah, that's the government collecting data. Am I being paranoid or realistic? I don't know, but you know, but the law, and I agree that there are some measures that go a little bit too far, but it's so important though to just like make that sacrifice. And I know that some people, economically, financially, they can't afford to not work or to close their businesses. But that I think is another area where government could step in again, more than $600, more than $1,200, because it's a national crisis. I mean, think about it. Pretty soon it's going to be 400,000 people. And so if we could all, I mean, it's like I heard people who supported Trump and they said, well, look at the stock market, it's going great. And I just felt like, and a friend of mine said, doesn't that move you? And I was like, I would give, $2,000 for some kids to be sent out of cages. I don't care what kind of person am I, that it's more important to me that my, retirement account is intact, is doing well, and that people are suffering. I mean, so there is a certain element to which we have to somehow sacrifice, which is kind of easy for me to say because I don't own a business or, I don't, and I have the privilege of staying home, but somehow it needed to be done and still needs to be done.
Definitely. And the point that you brought up on this is one of the things that we noticed early on, that the US was completely ill-equipped, and especially because of our trade relations with China, and so dependent on China in getting PPE, like protective gear. How can we stop this from occurring further? Like what next? The next pandemic hit, and it's going to hit. We were unprepared for this one. What can we do to make sure that we use the Biden administration and be prepared for the next pandemic?
I mean, Biden and Obama kind of were prepared. They had created that whole, whatever it was, pandemic department. There was a plan. They knew it was coming. And when Trump came to office, that was one of the departments that he just said, he just got rid of. So they already knew. So Biden is well aware, of what needs to be done. And he's promising a lot of things will happen on his first day. And I think we need to all hold him to that.
Brother Mohammed?
Yeah. I mean, there's so many things that that should have happened that did not happen in the last 4 years, and I'm very confident that Biden and Harris and their administration, they are gonna rely on scientists. They are going to rely on experienced, skilled people, and not just political appointees that are loyal to the president and get the job done. So I have full confidence that in the 4 years of Biden presidency, we are going to be back to where things should be. So we are ready, and all the lessons learned that we have will be implemented, and hopefully, well, with Congress and Senate helping support the budget and the resources that are required to implement all those will happen. It's an uphill task, but I think with hopefully with the Senate under control and the majority in Congress, I think we can get a lot of things that need to happen and implemented.
Yes, definitely.
Yeah,
I would say that as I take a look at this, that we United States uh, response to this, aside from Trump, I felt that our healthcare systems was unable to withstand a prolonged health crisis. Our healthcare industry, the for-profit healthcare industry, has destroyed is destroying American lives. And our struggle to respond was partly due to these years of budget cuts, austerity measures. We struggle to source adequate PPE, diagnostic tests, and we've outsourced all of this to China, and this remains a concern. We need to have local industry here in the United States that prepares and bring that back, not just keep outsourcing this, because this is a security crisis. This is what the Homeland Security should be focusing on, instead of targeting innocent Muslim boys in mosques. Rather, you know what I'm talking about. I'm sure Sister Ruth knows what I'm talking about. So this is something that I feel like really, 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 whether it's the Biden administration or whoever comes next, we really need to work on discrimination in healthcare settings, marginalized groups, racial, ethnic minorities, especially women, older people, incarcerated population. All of these have been so vulnerable. These are like, it exposed the holes in our system. And
right.
I really truly believe that this is something that we need to hold. But we can't just let I know there's a sigh of relief, even though what's happening on Capitol Hill right now is seriously troubling. But as we do that sigh of relief, we really, really need to hold the Democrats' feet to the fire as well, and not let them. They didn't push hard enough. I don't think they pushed hard enough. You'll see how the Republicans push against everything that they're, remember Obamacare, how they pushed against everything. I do not think that the Republicans did that, holding this administration as much as they could have. They sort of all were awe and shock, like the entire time. So, but that's because I'm an independent, so I can say that. Thank you so much. As we're winding this hour down, any final thoughts from each of you before our hour ends?
I mean, I would just again want to encourage people to go to the website, check it out, and if you have a loved one who's passed away from COVID, please do consider sharing their story on the wall, because again, our goal is everybody. Everybody deserves to be counted, and that's what we want to do. And we
Yeah,
want
and share the website with your friends, with your neighbors, with your contacts. Post it on Facebook, tweet it out. If you do Instagram or TikTok, just spread it as forward, because 603 victims is like 0.15%
literally.
of the victim that we have here in the US. So we have a lot of work to do to honor these victims on our wall.
Yeah, and I can hardly even remember how many Muslims there are on the wall, like a handful, I think.
Mm-hmm.
So we definitely need broader representation. We need to represent our own stories.
Definitely. Well, thank you to both of you for being here and for being a part of the show. And to all of you, keep coming back. You can watch us on Galaxy 19, Muslim Network TV. We just did a soft launch this past on New Year's Eve. And so many of you were excited to see what we're bringing forward, comedy shows and lighthearted. We're having a cooking show coming up. So it's not all just politics and hardcore stuff. Please, and there's lots of children's programming. Please tune in. You can watch, go and see the sampling of programming on www.muslimnetwork.tv. So thank you to all of you. Assalamu alaikum.